Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by SpaMedica. Hello and welcome, Dr. Stephen Mulholland here in Toronto, Canada with Plastic Surgery Talk. We are here for our latest installment of our podcast series, and today is on an exciting and innovative technology called Emsculpt. If you find these podcasts entertaining and educational, please share, subscribe, and comment. So what is Emsculpt? Emsculpt is quite revolutionary because it attacks the destruction of fat and the shaping and contouring from a whole different angle. So Emsculpt is a body contouring, non-invasive technology. It fits under the pantheon of things like cool sculpting, sculpture, body effects, Vanquish, Excelus, Venus Freeze. It's a non-invasive technology designed to contour and shape and enhance. But how does it do that? Emsculpt works from the inside out. Totally different. We've got lots of things that can tighten skin from the outside, quite a few good things that can kill fat from the outside, like cool sculpting, sculpture, Vanquish, and body effects. But we have nothing until now that can shape and increase muscle mass, tone, and appearance of your muscle contour and kill fat from the inside out. That's what Emsculpt does. It uses a pulsed high-intensity electromagnetic field to stimulate muscle contraction, but not just any old muscle contraction, not like the stuff you do in the gym where you're doing your crunches and your workouts. It's supramaximal contractions. In that 30-minute treatment, it's a 30-minute treatment where we use electromagnetic fields with two paddles on each erectus abdominis or the gluteus maximus, the buttocks, or the thighs. We induce over 20,000 supramaximal contractions. You can't approach that kind of conditioning even if you're a bodybuilder or you're a weight trainer. So at the end of that 20,000 contractions, a series of 4 treatments over 2 weeks, we can increase the number of muscle fibers and the size of those muscle fibers by about 20%. The fat overlying that muscle gets so traumatized by these supramaximal contractions, the physiologic response is to break down the fat, and we induce a non-inflammatory death of the fat cell called apoptosis. And we can kill, again, 18 to 20%. So we can increase your muscle tone and your definition by 20%, and we can reduce the fat over that muscle by 20%, all from the inside out with the Emsculpt. Who's a good candidate for the Emsculpt? Well, for abdominal flank contouring, it would be for your lower BMI patients, patients under a BMI of about 28. They have some pinchable fat, but they really have a little bit of fat and some muscle contouring opportunities. And so for your larger BMI patients, we'll generally put them on other technology first, like the Vanquish, cool sculpting, sculpture. We'll shrink their fat down, then maybe add the Emsculpt. A primary Emsculpt candidate has a modest amount of fat, perhaps 4 centimeters or less, have a lower BMI, and they want to also contour, tone, and increase their muscle mass. They should not be pregnant, they should not have any pacemakers of any type, and they shouldn't be medically unwell, and ultimately realistic. This is not going to be liposuction, but it's going to be the best contour and shape we can build, including the muscle, without surgery. The Emsculpt really opens up a whole area of body contouring and non-invasive shaping to those who are really into weight training. Bodybuilders or aggressive weight trainers, guys or women who really want to get that ripped six-pack look, that ultra-defined look. We can take the muscle integrity and the size and shape of what they can build on their own in the gym, and we can add that 20% to it. Those supramaximal contractions, 20,000 each treatment, can be additive to a result that they're reasonably happy with. We can take it to the next level. So what muscles? We can build up the abs, rectus abdominis, interlacerational oblique, the rectus femoris, or the front of the thigh muscle, the hamstring, or the back of the thigh muscle, and the glutes, the gluteus maximus. Those are the muscles we can focus on with the Emsculpt for bodybuilders and even for non-bodybuilding patients who want to kill the fat and shape the muscle. So how does Emsculpt treatment work? It's very, very simple, very straightforward, very comfortable. This is electromagnetic field, so there's no lasers, no thermal injury, there's no numbing cream needed. It's very comfortable. You have the feeling of muscle contraction. We start out with low energy, get to higher intensity pulse fields, but it's always very tolerable, far less uncomfortable than any other laser treatment we offer in the clinic, and so it's very comfortable. It takes only 30 minutes. We take the electromagnetic field paddles, and we put them on the rectus abdominis or on each gluteus maximus or on one front of thigh, the other front of thigh. We dial up the energy, and you start to feel little pulling, then little contraction. We increase the energy over a couple of minutes until we get into the supramaximal contractions. And then we just leave it for 30 minutes. Very straightforward. Patients can read through a magazine. They can't do any cell phone calls because the cell phone field may interfere with the electromagnetic radiation field of the Emsculpt. So 30-minute treatment. We do 4 treatments, 2 weeks apart. And at the end of that series of treatments, about a 1 month later, you're going to see up to 20% increase in the size and the bulk of the muscle mass, and you're going to see 16 to 20% reduction in the fat. So what can our Emsculpt patients expect in terms of results? If properly selected and we have undergone a consultation where we talk about the risk of not achieving liposuction-like results, expectation management has been established, most patients are very happy. Studies show that a well-selected patient who's got reasonable expectation, about 95% satisfaction with the treatment protocol. What can they expect? They can expect more definition in their muscle hypertrophy, both in size and number, so a muscle mass increase for more tone, more definition, and we shrink and kill the fat over top of that muscle so you see it better. At the end of the program, we always meet with our patients and we review their before and afters. And inevitably the question comes up from the patient, or we bring it up, you know, is this result permanent? Can you keep this forever? And the answer is yes and no. First of all, if we've killed fat that overlies the muscle and you maintain the same weight neutrality, don't put on much, don't lose much, stay within 5 pounds of your treatment weight, the fat that you killed over your rectus abdominis, the fat that shrunk over your external internal oblique, the fat that is shrunk down and tightened on your anterior thigh, that's gone forever. So that's a permanent result. This is not temporary fat reduction, it's permanent fat reduction. So you get to keep the fat reduction forever, you just got to maintain your weight. But the muscle mass, the hypertrophy, and the increase in muscle fibers, you can't maintain that with normal crunches alone because you've achieved it through supramaximal contraction. So we recommend that patients come at least once every 12 weeks, 4 times a year for 2 treatments in that week. So 2 treatments every 12 weeks. With an affordable payment of those treatments, very affordable. You spend more in your hair care or your nail care than you would on maintaining your supramaximal muscle mass increase. So every 12 weeks for 2 treatments. Some patients who are really into it, we find they come every 6 to 8 weeks. But at the very least, every 12 weeks for 2 treatments to maintain that muscle hypertrophy, the muscle mass tone and contour forever. The nice thing about the Emsculpt, it's very easy to perform. And it's very easy to be the treatment patient. There is no redness, no inflammation, because there's no heat. It's not a laser. It's pulsed high-intensity electromagnetic field, so there's no evidence on the skin you had the treatment. So you can go right back to your normal activities, immediately right back to work. You could go right to the gym. You could run a marathon right after if you wanted to. There will be some reaction, much like working out in the gym, 48 to 72 hours later. You'll get kind of that lactic acidosis, bruise, mild sore feeling of your muscle, just like we've all had if we went to the gym and got too enthusiastic when we haven't really had any preparation. So there will be that sense of lactic acidosis, muscle achy at 48 to 72 hours, but you are completely unrestricted in any activity you want to do right after. There's no recovery instructions, there's no certain amount of fluid you gotta drink, no dietary restrictions. You're completely able to go right back to your normal life. So Emsculpt works from the inside out. We build up the muscle, we kill the fat from the underneath. But we can get a better result than just one technology alone. So Emsculpt is a standalone treatment program for smaller BMI patients. But patients who have a little larger BMI or a little bit more fat, we may layer on one of our other technologies from the outside in. A product like Cool Sculpting, which is sustained hypothermia and cool exposure to kill fat, or sustained heat with sculpture, or electroporation with body effects, or the use of a large microwave field using the Vanquish, a very high frequency radio frequency / microwave field. The Vanquish can kill fat from the outside in. So we can select any one of those technologies, combine it with our Emsculpt from the inside out to get a better fat result while still building the muscle. So yes, we can combine additional fat destruction technology. And lastly, if there's a little bit of compromised skin tone on the abdomen or on the buttock, we can apply a bulk heating skin tightener a radiofrequency skin tightener. Products like the Emsculpt, the Venus Freeze, the Forma, the Body FX, Temperature Envy, VeloShape 3, all these bulk heating RF technologies that tighten skin. We can also add that on to our multiple layer approach to body contouring. So we can tighten skin, kill fat from the outside, kill fat from the inside, and contour muscle. Emsculpt is our only solution at this time for the inside-out approach. So what are consumers looking at paying for an Emsculpt program? It depends on the physician that owns the product, the practice, the city the practice is in, what you spend in Toronto, New York, LA, Chicago, Miami, Dallas may be different than what you spend in Middle America. However, the approximate treatment prices now that I see across North America, including the larger Canadian cities, include a package of 4 treatments, 2-week program, 2 times a week to complete the Emsculpt for approximately $3,000 or $750 a treatment. Now, you may layer on cool sculpting or sculpture and a skin tightening technology like Emsculpt or Forma or Body Effects, and that will add incrementally to the cost. But it's a sliding scale. If you add things, the price of each of those new add-ons goes down. So in general, even if you did all 3 techniques, skin tightening, fat destruction from the outside, and Emsculpt from the inside, you're looking at half the price of liposuction for that zone. The maintenance cost is generally about $750 for the 2 treatments done once every 12 weeks. So reasonably affordable maintenance that will maintain your result really for the rest of your life. So how do you choose your Emsculpt physician? Well, right now, this is very innovative. It's very new. There are less than 200 systems in all of North America. So how do you choose your Emsculpt physician? You simply Google it. Emsculpt My City. Up will come 1, maybe 2 choices. Now, usually, they're going to be guys like me, technology aficionados, owning centers that are non-invasive, that have multiple options. They may already have a Cool Touch and a Vanquish and an Emsculpt and a Sculpture like I do, so they're going to give you multiple options. But they're probably going to be first train out new innovators, market leaders, thought leaders. Now that's who you're going to find. 6 months from now, a year from now, there'll be thousands of Emsculpt-like products around the North American market. So now you're going to go to some of the best guys, because it's the best guys who usually buy early. Well, thank you for joining me again, Dr. Stephen Mulholland here in Toronto, Canada on Plastic Surgery Talk. We had another podcast, a really new and innovative, exciting technology, Emsculpt. Again, if you find these educational, informational, or entertaining, please share, subscribe, and comment.